You may have heard the term before. The food went down the wrong throat. I had a serious encounter not so long ago. My father was in the hospital recovering from surgery. He just had a stroke. He asked me for some water. I gave it to him. He started to choke. I panicked. After he stopped choking, he said to me, the water went down the wrong throat. This motion is known as dysphagia or difficulty swallowing. Dysphagia affects our elders and patients with stroke. I've worked in the health field for over 13 years. I've seen a lot of these cases. Difficulty swallowing is something we always have to look out for. There are two types of dysphagia: transfer dysphagia and esophageal dysphagia. Transfer dysphagia is common in stroke patients. When after the patient has stroke, their muscles become weak. Then they can't trigger the swallowing motion. Therefore, they choke on their food. According to W.J. Hamilton in the Encyclopedia of Global Health, 51 to 73% of stroke patients suffer difficulty swallowing. Difficulty swallowing in stroke victims can be corrected with practice and medication. Esophageal is a form of dysphagia. This can be subtle or severe. This causes a blockage in the throat where if you're swallowing, it is very difficult. For instance, if a patient have a tumor in the throat, if the tumor is small, they choke, once in a while. But as the tumor gets bigger, they tend to choke on everything that they eat. As this kind of dysphagia affects the food channel. When the patient tries to initiate swallowing, it goes down real slow, causing a clinging sensation in the throat. Swallowing is a complex motion. We use 50 muscles to swallow. I did not know that. That's 50 muscles to swallow. Persons who suffer from difficulty swallowing have to be monitored when they're eating. We have to make sure that they're sitting upright. So that they don't aspirate on their food, right? Aspiration can be life-threatening. But with the right regulation of food, patient can be monitored. This is a chart of food regulation or modified food for patients with dysphagia. We have regular food, then we have soft bites or mince, then we have puree or liquidized food. Also with the liquid, we have thin liquids, slightly thick, moderately thick, and moderately thick liquids, right? I'm going to show you some examples of a soft diet. This is a classic meatloaf. It looks delicious. That's a soft diet. And this is a minced diet. This is the second stage of dysphagia, where the food had to be cut up in small pieces so it will be easier to swallow. And this is a puree diet. This is the third stage of dysphagia, where everything has to be pureed and soft. Also, there are 4 types of liquid. We have thin liquid, the regular water. See how thin it is? Regular water. Then we have nectar. This is slightly, a little bit thicker than thin. Then we have honey, which is the second stage of dysphagia. And then we have a pudding texture. Right. So as you see, persons who suffer from dysphagia can still have a balanced diet. 15% of our elders suffer dysphagia. 40% of our elders that live in long-term facility suffer from dysphagia or difficulty swallowing, according to Andy Brady in the Home Health Aid Nurse magazine. I work in these facilities. I've seen what it does to the patient and their family. Families are worried about their mothers or father not eating because they don't want the modified food. Patients tend to have malnutrition or dehydration because they don't want that kind of food. Imagine you have always been eating your regular meal, but now you have to have modified food. But modified food are well-balanced meal, so the patient can stay healthy and have a good life as always. Remember, dysphagia or difficulty swallowing is a serious medical condition. It can be corrected in some cases, and in other cases, it is a lifelong condition that the patient have to stay on modified food, or some patients have liquid diets. So always remember, when you go to visit your loved one in the hospital, ask before you give them anything to eat.